Hi everyone, in today's video we will be answering our Genius Hour question. Is it ethical to use methadone to treat heroin? We will be answering this question by looking at the case study of Rachel, who was once a heroin addict. So let's get started. First, let's take a look at Rachel's case study background. Rachel was a heroin addict since adolescence. She started heroin at the age of 17 years old. She never had a strong support system, as her father left the family shortly after she started her addiction, and her single mom struggled to raise her by herself. Rachel used to store heroin and also use intravenous injections. After a while, she became homeless, and she ended up working at a gas station to supply herself with money to continue her addiction. One day, a nurse advised Rachel to come into the methadone maintenance treatment program. The treatment goal was to stabilize Rachel on a steady dose of methadone, and then transfer Rachel to a methadone clinic on the third day of treatment for long-term methadone maintenance. This treatment was successful for Rachel. Rachel was transferred to an outpatient methadone treatment program, and she needed a highly dose of methadone to stop her from using heroin. Rachel's story is one of a success. Now we will look at how methadone treats heroin scientifically, the ethical issues surrounding it, and what Rachel experienced during this program.
The IUPAC name of methadone is 6-dimethylamino 4,4-diphenylheptane 3-one, and the molecular name is C21H27NO, and the structure that methadone has is 2 benzene rings, a ketone, and a tertiary amine. Methadone is a long-acting opioid drug used to replace the short-acting opioids that someone may be addicted to, such as heroin, oxycodone, fentanyl, or hydromorphone. This means that the drug acts more slowly in the body for a longer period of time. The effect of methadone lasts for about 24 to 36 hours. However, a person who uses the shorter-acting opioids to avoid withdrawal must use it 3 to 4 times a day. If methadone is taken at the correct dosage, it prevents withdrawal symptoms and reduces drug cravings without causing the person to feel high or sleepy. This lowers the harm associated with opioid misuse and gives people who are addicted to opioids a chance to stabilize their lives. This treatment is known as methadone maintenance, which is a type of opioid against therapy. Methadone maintenance is a long-term treatment. The length may vary from 1 or 2 years to even 20 years. There are many pros and cons associated with the use of methadone. Some pros include it blocks opioid effect, reduces withdrawal symptoms, cost of methadone is far less than the cost of other treatments, and it lasts for at least 24 hours. Some cons include that it can be addictive, habit-forming, abuse is possible, and potential to relapse on other opiate drugs.
So what is methadone's mechanism? Methadone's primary mechanism of action is as an agonist at opioid receptors. In other words, it activates opioid receptors similar to the way other opioid drugs like morphine would. It also acts as an antagonist or blocks NMDA glutamate receptors, which is thought to contribute to its pain-relieving effects. Since methadone has a similar mechanism of action to other opioids, methadone causes enough stimulation of opioid receptors to reduce cravings for other opioid drugs and to prevent a patient from experiencing withdrawal symptoms. Unlike most other opioids, methadone typically only has to be administered once a day to achieve these effects. Additionally, methadone also occupies opioid receptor binding sites, which diminishes any effect another opioid might have, also discouraging the person from using other opioid drugs while taking methadone. Altogether, methadone's pharmacological action lowers the likelihood a patient of using another opioid drug.
Rachel is a struggling heroin addict and has been using heroin for quite a while. When it comes to prescribing medication, it is very precise and is made for the patient's needs. Methadone can come as a tablet, a liquid tablet, a solution, and a concentrated solution taken by mouth. Rachel took the methadone in tablet form, which was about 1 tablet a day, which is 52 milligrams, and she took it every 2 days to start off. The difficult part about getting a methadone treatment is that the doctor will provide a medication schedule for the methadone and it must be followed strictly. This is to help prevent overdose or further addiction, as methadone is a synthetic opioid drug, which means the chance of re-addiction is likely. The amount of methadone Rachel will take will increase by 5 to 10 milligrams every few days to reduce the craving for other opioids. As Rachel continues through her program, she will increase her doses to minimize the need of heroin. As the doses increase, it will become more important for her to take the right amount. If she does stop taking the medication, she will relapse and the effect of the medication will not work. When she relapses, she will have to restart her treatment, which will cause withdrawal symptoms such as chills, anxiety, muscle aches and pains, nausea and vomiting, irritability, and hallucinations. These are the most common symptoms and will likely happen if she suddenly stops taking the medication.
Those who choose methadone replacement therapy will experience the benefits and may also experience some mild negative side effects. In Rachel's case, she experienced reduction in infectious disease due to stopping opioid abuse, particularly injection drug abuse, overall improvement in quality of life, improved social functioning, better chance at long-term recovery success, and lastly, it can also reduce criminal activity for people due to stopping illicit drug use. The cons of this program include mild symptoms such as stomach ache, constipation, or sweating. A serious side effect of methadone include slow breathing, sexual dysfunction, nausea, vomiting, restlessness, and itchy skin. This finally leads us to our genius hour question. Is it ethical to use methadone as a treatment for heroin addiction? There are a few ethical issues surrounding this matter, such as a few people argue that methadone is surely changing one drug with another, without addressing the motive why the man or woman commenced the usage of heroin within the first place. This can make human beings susceptible to begin the usage of tablets again, if the motive for his or her preliminary use isn't additionally addressed similarly to the bodily addiction. In addition, hospital-run methadone programs have a virtual monopoly on the provision of opiate substitution programs, leaving clients with limited options if they want to leave methadone programs.
And lastly, depending on the patient and the circumstances, methadone may not work as it helps shift patients away from hardcore drug abuse. However, when we take a look at Rachel's case, this program was very successful for her as she becomes a functioning citizen of society. She works 2 jobs, she has an apartment, and most importantly, she stops abusing heroin. The methadone maintenance treatment works 90% of the time, leaving only a 10% chance of unsuccessful cases. It raises a patient's chance of long-term recovery compared to a patient who does not use methadone treatment to stop taking opioids. Overall, as of now, methadone is the best program to treat patients with heroin addictions.